I think there would be a lot more people who would not have survived this without physicians.
It's no secret who's been on the front lines of the pandemic, as medical staff, including doctors, have been working around the clock.
All members of the healthcare team are really, really important, but I think that, one of the really important things is to make sure, is to have enough physicians to answer a lot of questions.
But in the future, that need could become a concern. A recent study from the Association of American Medical Colleges says the U.S. could see a shortage of physicians, anywhere from 54,000 to nearly 140,000 by the year 2033, something that doesn't surprise Dr. Wendy Grant of UNMC.
So I totally agree. I mean, this is something that has been in the works and has been discussed for a really long time.
The study mentions how population growth and life expectancy rates would continue to outpace the number of needed physicians. Dr. Grant also says there's an ongoing issue when it comes to getting people to practice medicine.
What has not kept pace with the increase in medical students is the number of residency slots. So if you don't do a residency, you can't get board certified and you can't practice medicine.
She says funding, especially from the federal level, would help increase residency slots. Others say the study doesn't take into account some crucial factors. If the cost of medical care does go up due to a lack of doctors, people may decide to live healthier, thus reducing their need.
To see a doctor is going to become very expensive, right? If that's the case, and then as a consumer, what I'm going to do, I probably is going to adjust my behavior.
Dr. Zigon Feng with UNO says the medical industry may be able to attract more people to be doctors because of better incentives like higher pay if there isn't as many to choose from.
We are going to see encouraging, or you are going to see more people willing to take the course, or maybe you can say that take the pen to go through this lengthy training or residency to become a doctor.
Dr. Grant says a shortage can impact you no matter where you live, and access to a doctor is something we shouldn't take for granted.
I mean, it's just a part of who we are. You have to be able to get health care.
Proper recruitment of medical students is critical, according to Grant. Visit our website, 3newsnow.com, if you'd like to check out that study.